The ICTA Project is an Open University-led initiative. It involves a range of faculties across the Open University, the business school, health and wellbeing, and counselling psychology. And it came about because in combination we were aware of the inequalities that trans people face in many walks of life, and particularly in healthcare. In 2016, there was a fascinating report produced by the Women and Equalities Committee of the House of Commons, and that concluded boldly that the NHS is letting down trans people. And obviously that isn't the whole NHS, but it was a judgment of that committee. And I think they meant a couple of things in particular. First, there are extraordinarily long waiting lists for the gender identity clinics or gender identity services that trans people who want to go through a medical transition need to be seen by. But beyond that, there was an awareness that in other parts of the NHS, trans people may face a lack of knowledge and understanding of clinicians and staff more generally. And this isn't that those clinicians and staff are badly motivated towards trans people. They may just feel a bit outfaced. They may experience a trans patient who appears before them as too complex. They don't know enough about their transition-related care or other aspects of healthcare. So they tend to refer that person elsewhere. And the result is people don't get the care they need it when they need it. In the ICTA Project, what we want to study are, above all, are examples of where gender identity clinics, the specialist clinics, are working well together with general practice, with primary care, with mental health services, with community support for trans people. So we want to try and capture these models and learn from them. And we're going to facilitate that learning in a number of ways. We're going to produce, first of all, just documents that summarise these stories of more integrated care. We're going to produce guidance for NHS commissioners of services and NHS providers of services. And we're also going to produce some online learning materials, something we've got a huge amount of experience of here at the Open University. And these are going to be targeted at a number of different groups of people. Firstly, for service users, for trans people who want to get the best out of NHS and other services. We'll produce some materials that explain what's available and what they should be looking out for and asking for. We're also going to produce materials for general practitioners and mental health practitioners in the NHS and elsewhere to explain what good integrated care for trans people looks like and how they can contribute to it.